I'm Professor Suchitra Pandit. I'm currently the head of department and consultant at the Kokilaben Dhirubhai Ambani Hospital. And sometimes, you really start wondering what is it, what is that pain that the patient has? Is it a chronic pelvic pain? And quite often, the patient would get labeled off as, oh, maybe she's got a psychological problem. It was only when we started thinking and we spoke to our urology team, which has Dr. Sanjay Pandey in it, and then we started talking about interstitial cystitis, and many a times it would happen that we would not know earlier, but now I know that there is a diagnosis. Of course, it's a diagnosis of exclusion, but at least now you have formed some kind of a treatment available. And in the last 1.5 years, we've had 3 patients with chronic cystitis, and they were wrongly labeled as a chronic pelvic pain. And then many of the times, people tend to say, oh, it's a psychological cause. So, though this is a diagnosis of exclusion, I'm very certain that there are certain pointers to it, and we should be able to, as gynecologists, we should be able to pick that up early and then refer the patient to a urologist who is also having an interest in this particular aspect, and then there would be a treatment. And I'm glad that I have started thinking about it, and I'm sure that many of my colleagues now would also start thinking once we spread that awareness. I'm glad that this initiative has been taken, because I think when we are thinking of women, we as gynecologists have dedicated our lives to remove the suffering of women, and where it is a preventable problem, yes, we do advocate all those instructions, but where there is a painful condition and it can alleviate pain, certainly I think these guidelines would go a long way and will create a lot of awareness. I would, when David Kaufman had come in, and there was so much to the pain factor of interstitial cystitis, and when I learned that Swati Spencer's, they were doing a lot of work and they were actually promoting this cause more than just a marketing gimmick, I was very impressed with that, because it's a cause. You're fighting for a cause, and then if you have a product to take care of that pain, to alleviate that pain, I think that's a great move forwards. And so I think I would like to congratulate the owners and the sort of visionaries of this company for having thought of this brilliant product, and the few companies that are actually making this molecule, and it has brought so much of relief. It's ease of use, it's easily available, it's not very expensive. I mean, patients can afford it, and if it's available and it helps, I think it goes a long way. Sometimes patients end up getting antipsychotic medication and temporary pain relief. So here is something which actually helps in healing the interstitial cystitis. I think that's a very brilliant molecule.